I'm Sonya Nobbe. I'm a naturopathic doctor. I've been in the Kingston region for 18 years. How many people are from Kingston here? Yeah? Great. There are a lot of people from Smiths Falls, Brockville, closer to Ottawa, I learned. So great breadth of experience here in the room. Thank you. So about 16 years ago, we bought the old Bertels Vet Hospital on Palace Road. If you're from Kingston, you know where that is. It's near the Kingston Center. And started Kingston Integrated Healthcare. And we've since moved into about a team of 12 health professionals, which includes a few naturopathic doctors, 4 of us, a couple of osteopaths, an acupuncturist, speech pathologist, trauma therapist. We've got a good variety. For the people who are interested in the more interesting fringe spiritual medicine and how spirit and human spirit have kind of taken a separation, we also have some really interesting practitioners who offer things like shamanic healing or Reiki or family constellations, Ayurveda, that sort of thing. And about 2 years ago, our patient database had about 10,000 patients, which was a real achievement for us. And just quickly, I want to go over what a naturopathic doctor is, because so many people still have not heard of a naturopathic doctor or have some other ideas of who we are or what we are. We have a very small profession. We're only about 3,000 practitioners in all of Canada. Most of us are concentrated in GTA area, but we're not a new profession. We've been here for about 100 years. And I think I'll just skip right through the bottom to explain that for a lot of people who are brand new to naturopathic medicine, we function a little bit more like family doctors as opposed to natural or integrated medicines. And our whole approach is to take the constellation of symptoms and ask, well, why are they there? And how do we get the body to fix this? Right? How do we not block this? How do we get the body to do the work so that real healing can happen, so that prevention really takes place? All right, and a few years ago, I got quite frustrated actually for how busy our manual therapists were at the clinic. Our physio, our massage, our osteo, they were booked up for 6-8 months, and a lot of patients that I was working with, who I needed to get in to see them so that I could move on to the next stage, I couldn't get my patients in. And so I came up with this integrated chronic pain program to try and encourage people to really take a much broader perspective of their pain, with the intention of encouraging patients to heal more quickly, be discharged more quickly, so that I could get my patients in. And so a lot of this program is about, when you have a musculoskeletal concern, when you have some pain, a lot of people think, I haven't tried osteopathy before, I'm going to try that. Or physio, that's what my doctor told me, that's where I'm going to go. But they don't actually think about, what if this is a drug side effect? What if this is a hormone imbalance? People who are 10 years out of menopause, and sometimes hormones can make a really big difference to that soft tissue. What about immune system? What about nutrient deficiencies? That kind of thing. So that's where the program really was developed, to address some of those gaps in care. And it worked really well, worked quite well. But then over time, I came to see that I had a subset of patients where we were just chasing the pain. And maybe you know some of these people, and a lot of it is, one day we'd be dealing with this really debilitating abdominal pain. All the imaging was normal, all the tests were normal, and then somehow it was suddenly gone, and now we're dealing with headaches. Same situation. We finally get that under control, and then we're on to the next thing. And the piece that stood out for me for these patients is that they were just so afraid of their pain, right? So afraid. So much so that the fear of the pain was amplifying the pain, and we were getting stuck. Almost like a trauma response, right? Like they were being triggered by the pain, and we were getting stuck, and I needed something different. And I came to understand, in part through working with a trauma therapist and a therapy called EMDR, if I could blend some of these pain therapies with trauma therapy, then we'd be really working with something, we'd be onto something, right? And through this time, I also met 2 interesting patients. One man who was in a motor vehicle accident and became wheelchair bound. lots of pain medications, but he discovered Vipassana meditation. Does anybody know Vipassana meditation? Well, those are, there are retreat centers globally, and newcomers or beginners are required to go to a 10-day silent retreat. So 10 days, no talking, and you spend a lot of time with your thoughts, with your emotions. And he maintained that practice, and he credits it with getting out of that wheelchair, getting off all of his pain medications, and getting his life back. Okay. Another was an elderly woman with migraine, and she read a book. And the book was about brain mapping, or a kind of brain retraining, and she just applied the principles in the book. Migraine's gone after like 30 years. You know? So I wanted to find something that blended this idea of brain retraining, or getting the brain to do the work, with the trauma therapy. That's when I found this concept called Pain Reprocessing Therapy, which has some great literature behind it. And that's when I found Mike. So Mike is a naturopathic doctor. He's my colleague. He works at Kingston Integrated Healthcare now online. And I'm hoping that you feel a bit more inspired and have some more tools to understand how this brain retraining you can really apply to a lot of the clients that you work with.
Thank you for the intro, Sonya. I was one of these people when I was a child who had stabbing abdominal pain. All my tests were normal. I saw all these doctors and specialists. No one had any answers for me. And so I knew that stress was a part of why I was feeling this pain, because every time I was stressed, I would feel pain. I would have digestive issues. And so I wanted to make it my mission to figure out like what was wrong with me. And so I went to Queen's University, and this is a picture from me in 2012. It's good to be back here. And so I did a Bachelor of Science honors in psychology and philosophy, so I could learn about this mind-body connection. And what I've learned is that the nervous system is what's connecting our brains to our bodies, and it's always communicating on a subconscious level, more than anything else. I'm also the first naturopathic doctor who's certified in pain reprocessing therapy in Ontario, and we will talk more specifically about that later. I and this talk are not endorsed by pain reprocessing therapy. It's just one treatment in the world, but it's evidence-based, and that's why I became certified at this rather than something else. So, our goals here today, first of all, are to open your minds to the possibility that the biomedical model does not explain chronic pain, okay? The biomedical model means that any kind of disease process, there's a physical cause. So if you can find the physical cause, you can give a medication, you can do a surgery, and basically you're fixing that cause. And so what we're trying to say here today is that chronic pain doesn't necessarily fit under this model, and hopefully you'll see at the end of today. And then of course to tell you guys about pain reprocessing therapy. But we can talk about the science of pain all day, but we only have a short amount of time. So if you have any questions, please save them to the end, and we'll answer them in the Q&A. And so before we talk about PRT, first we have to talk about the types of pain, how pain is processed. Then we can talk about who can benefit from PRT, what does PRT look like, and then I want to do a little bit of a somatic tracking demo at the end. And somatic tracking is one of the tools that we use in pain reprocessing therapy that's kind of like a meditation, but a little bit different, and it's informed by neuroscience. So there are 3 types of pain. The first one is what we would all traditionally think of as pain. So this is called nociceptive pain. So this is injury or inflammation. So if you hit your knee on something, then it's gonna activate the nociceptors in your tissue. So these are receptors that are pain receptors, right? And then they'll send a signal. Neuropathic pain is a second kind of pain, so that's nerve damage. So if you damage your nerves, if you have diabetic neuropathy, or if you have shingles or something like that, that is neuropathic pain. And the third type of pain is neuroplastic pain, which we would argue is what most chronic pain is. So the definition of chronic pain is any pain that lasts longer than 3 to 6 months. And what does neuroplastic mean? So has anyone here heard the term neuroplasticity before? Okay, great. So neuroplasticity literally means it's the ability of the nervous system, primarily the brain, to change in response to learning something. So anytime you learn something, your brain is actually physically changing. And so why this is important is because all of these words on the left here, these are all words that have been used since the 1700s to describe this kind of mind-body phenomenon that science just didn't really know how to explain. And so nociplastic right here is the most common word that's used in the medical literature. So the nociceptors, the pain receptors, and so plastic means changing. So, we all knew that, the receptors are changing in some way, but they didn't really know how. Psychosomatic is also a common word that's used, functional, but my favorite is medically unexplainable. So really, like in the medical literature, they say this is medically unexplainable. We don't know how to explain this. So how is pain processed? This is a very simple diagram, and so traditionally it starts with tissue injury, right? So you injure yourself, it causes some inflammation, there's some chemicals in the area, and those chemicals will activate the nociceptors. Then there's a signal that goes to the spinal cord, and the spinal cord goes to the brain, and this is a super simple diagram, okay? So there's not just one center of pain in the brain. There's like between 8 to 12 centers of the brain, depending on who you talk to, and so the signal has to go to the brain, and then it has to be interpreted. And then I'll also draw your attention to this. So there's a descending inhibitory pathway. So depending on how the pain is processed in the brain, it could be reduced or amplified depending on the context. So here's our first piece of research that we're looking at today. Under the biomedical model, physical pain and emotional pain are treated differently. But actually, that might not be true. So in this study, what they did was they recruited participants who had a recent breakup. And they got these people to look at pictures of their ex while thinking of feelings of social rejection. So, very cruel thing to do to people, but in the name of science, sometimes we have to figure some stuff out, right? So, these people are looking at pictures of their ex while thinking of being rejected by them, and they put them in a functional magnetic resonance imaging machine. So, this is a machine that is detecting the activity in the brain. And so, these are the regions of the brain that were lit up when they thought about that. Then they took these same people and they put a hot rod on their skin so they felt the pain. And so this hot rod activated the same regions in the brain as thinking of social rejection. How interesting is that? This phenomenon has also been demonstrated experimentally. So we all know that Tylenol is for physical pain, right? You have a headache or you hurt yourself, you take Tylenol, you feel better. Tylenol or acetaminophen also reduces the feelings of social pain. So what they did in this study was for 3 weeks, they gave one group Tylenol, they gave one group a placebo, and in those 3 weeks, the Tylenol group felt less social pain statistically significantly than the placebo group. So how does that make sense, right? And so here is a theory in neuroscience called predictive coding. And so in predictive coding, basically the idea is our brains are constantly generating and updating a mental model of the world to explain how the world works. And it's using this mental model to keep us alive, okay? So our nervous systems are only concerned with safety or danger. Sometimes you'll be in a situation where it's gonna be life or death. You have to make a really quick decision or you're literally gonna die, right? And so this is a picture of a stick, right? But imagine for a moment that you are one of your ancestors, like thousands of years ago, and you're walking through a forest and you know that this forest has deadly snakes in it. Maybe a snake bit someone you knew and they died, right? So if you're walking through a forest and you see this shape out of the corner of your eye, the people who were able to run away and recognize that as a snake survived more than the people who were like, oh, like, is this actually a snake or is this a stick, right? Those people died and their genetics did not get carried along. And so this is the idea of predictive coding. So our brains are always evolving shortcuts to survive because sometimes you need to make that quick decision so that you're gonna be able to make babies and those babies will make other babies, and then that's how we all ended up with predictive coding in our brains. And so what we want to kind of convince you guys today is that we don't sense with our bodies, we sense with our brains, because all the signals have to go to the brain, right? When you get hurt somewhere, that signal is going to your brain and it has to be interpreted. So, I'm assuming everyone here has been bitten by a mosquito before, so you know how uncomfortable this image is. So this has probably happened to you. This happened to me last summer. So I was in a room with a mosquito, and this mosquito bit me. Okay? And so when the mosquito landed on my skin and bit me, it activated this predictive coding in my brain. So it reminded me, okay, this is what it feels like for a bug to land on me. This is what it feels like for a mosquito bite. So all night I kept thinking that mosquitoes were landing on me. I was slapping myself and I was like, oh geez, like tomorrow morning I'm gonna wake up and I have all these bites on me. The next day I woke up, I didn't have a single other bite on me. my brain was playing tricks on me to keep me alive, right? Because these, the mosquito can have a disease in it or something, so I needed to slap it right away without even looking at what it was. Has this happened to anyone before? Okay, so I'm going to show a series of optical illusions here to also kind of show that sometimes your brain will play a trick on you. So this is called the rotating snake illusion. This is a famous optical illusion. So if you move your eyes around this image, it should look like the circles are spinning slightly. Okay? I promise this is an image that I copy and paste into this presentation. I actually don't know how to put videos into presentations, so this is a picture. Okay? Has everyone here seen The Matrix? So The Matrix, great series of films. So you can hear Morpheus here say, "What if I told you?" But "what if I told you" doesn't actually say, "What if I told you?" Did anyone here read this as "what I have told you" or as "what if I told you," right? So your brain is putting something into your brain is reading something that makes sense, right? It's taking shortcuts in order to make sense. Here is a famous drawing. It's called my Wife and My Mother-in-Law. I don't know if you guys have seen this before. So there's an image of a young woman and there's an image of an older woman here. You can't see both of them at the same time. I'll give everyone a few seconds here to see if you can see both images. So depending on your experiences and what visual cues you see first, you'll see one of them first, right? For people who are not seeing this yet, the left ear of the young woman is the left eye of the old woman. Okay? So keep this in mind. You can't see both images at the same time, but you can switch your awareness between these images. Okay? This is kind of what we do in pain reprocessing therapy, so keep this in mind. Okay. This is a real picture that was published in the British Medical Journal. This is a real case that happened in 1995. So what happened was a construction worker jumps down onto a 15-centimeter nail. And everyone here, I can see your reaction. Yeah, that's going to hurt, right? He sees the nail go through his boot. He's in such excruciating pain that he needed to be sedated with 2 drugs, fentanyl and midazolam. He's rushed to the emergency room. And he gets to the emergency room, they're rushing to take this boot off. They take the boot off, and the nail didn't even pierce the skin. It went in between his toes. So, under the biomedical model, there was actually no physical damage at all. But how did he feel so much pain, right? Remember predictive coding. He used all the cues. If you see a nail go through your boot, you got to go to the emergency room, right? You might die. So his brain was giving him a signal to keep him alive. And does everyone here know this idea of conditioning, classical conditioning? So for anyone here who doesn't know, basically, this is Pavlov's dog, very famous dog. So a dog will naturally salivate into the sight and the smell of food, but they won't naturally salivate to the sound of a bell. But if you ring the bell with food for enough repetitions, then just the bell alone will make the dog salivate. So keep this in mind as well. This is neuroplasticity. This is kind of how pain works as well. And so, if someone gets injured and they're hurt for, let's say, 3 to 6 months, they learn that certain movements are going to cause them pain, right? So after those months, their brain still thinks it's going to cause them pain. So that little bit of movement, yeah, it's going to hurt because it's protecting them, right? And so something that we see in practice all the time is that it's pretty stressful to get hurt or to be injured. And so the feelings of stress will actually also trigger pain in a lot of people, right? There's a famous saying in neuroscience. It's called, it says, neurons that fire together wire together. So it actually doesn't matter why the neurons are firing together. They just will, because there's been so many repetitions, right? Okay, here is another piece of research here. I know it looks a little bit complicated, but basically, we remember the case of the boot. So that's one case. This is a systematic review of 33 studies on more than 3,000 people who did not have back pain. Okay, so all these numbers are for people who did not have back pain. These columns are the ages, okay, and these are the imaging findings. So what they found was for these 3,000 people who did not have back pain, more than 50% of people over the age of 30 have some kind of disc degeneration and no back pain. Okay? Once you get to 60, 70, 80, that's like 90% of people who are in this age range have some kind of a structural abnormality in their spine, and they do not have back pain, right? Under the biomedical model, if you have some kind of a damage or structural issues, it's going to cause you pain. Not necessarily true. And the opposite is also true. So here is a screenshot from the World Health Organization from 2023. What they say is that low back pain is the single leading cause of disability worldwide. What they also say is that non-specific low back pain is the most common presentation. So about 90% of people who have low back pain, they couldn't find the reason why they have low back pain. All the imaging is clear, all the tests are clear, but they don't know why, so they call it non-specific, right? That doesn't make sense. Why can't they find a reason? There's no drug, there's no surgery for these people. The reason why this is so important is because a correct diagnosis will lead to the correct treatment, and an incorrect diagnosis will lead to incorrect treatment. And so, from our perspective as naturopathic doctors, it's actually kind of an ethical situation here, right? So, failed back surgery is so common, it's been given a name called failed back surgery syndrome. Up to 50% of anatomically successful back surgeries experience poor outcomes. So people, they get a back surgery, all the imaging looks clear, everything looks perfectly fine, but they still have to take medications and they still want to go back for other surgeries, right? Kind of an ethical issue, like you're putting these people through so much, they're actually damaging their spines and they're not even getting better, right? In naturopathic medicine, we say first do no harm. Do the safest treatments first before you start doing anything that's really going to mess up your body, right? And that's kind of where pain reprocessing therapy comes in. So here is the study on pain reprocessing therapy. And so not coincidentally, they did this on people with back pain because it's the most common form of chronic pain. And so what they did was they recruited participants between the ages of 21 and 70 with at least a 4 out of 10 intensity back pain. So 10 being the most pain they've ever experienced and 1 being the least pain. So they were on average 4 out of 10. They separated all the participants into 3 groups. So the first group was the PRT group. Second group was an open label placebo group, so saline injection. So they told these people, we're going to inject your spine with a saline injection. It's not going to do anything. This is a common group that's used in research on back pain. And then usual care. So whatever they're doing for their back pain, just keep doing it. And the PRT group had 8 sessions over 4 weeks. And here are the results. So if you can see here is the PRT group. After 8 treatments, the PRT group had 66% or 2/3 of the PRT group reported no pain or nearly no pain at the end of 8 treatments. And that's in comparison to 20% of the placebo group and 10% of the usual care group. And after these 8 treatments, they measured their pain 1 month, 2 months, 3 months, 6 months, and 12 months afterwards, and these results stayed a year later without any other treatments. Because of all this brain retraining, they actually retrained the brain to not feel this anymore. And so here you can see all the dots at the -100. These are all the people who became completely pain-free after 8 treatments. And then here's the placebo group and the usual care group. The dots are all over the place. And here is just a bar graph showing all the people who had less than a 1 pain at the end of the treatment, right? So here everyone has average 4 out of 10. Here it goes to 1, and then the other 2 groups here about a 3 out of 10. So who could benefit from pain reprocessing therapy? I'm not going to go through all of these. There's an article on our website, and there's a QR code at the end, so you can read these more in depth. But I'll just highlight 2 of these here. So the first one is the most obvious. If someone's symptoms began without injury, or if there's an injury, they persisted longer than 3 to 12 months, that means that they probably have like a neuroplastic pain, right? Like they learned these connections, these neurons were firing for this long, so they kept going, right? And then the second one I'll highlight here is symptoms are inconsistent. So if someone just has pain when they go to work, I see this all the time, so they have pain when they go to work, they come home or they're gardening or they're doing things and they don't have any pain because they're having fun or they're forgetting about it, that's a pretty good sign that it's a neuroplastic pain, right? It's context dependent. And these are also people who could benefit from PRT. So you may have heard of fibromyalgia, chronic fatigue syndrome, irritable bowel syndrome. That was me, right? So these are called central sensitization syndromes in the medical literature because they know that there's something to do with the nervous system, right? The nervous system is so sensitive to different sensations that it's causing people pain, but they don't have any answers for it, right? But, you know, some people do. And, oh, is that it? Okay, here we go. So here are the pillars of pain reprocessing therapy. I'm just going to highlight these and go really quickly. If you have any questions, you can ask at the Q&A at the end. And so, the first pillar of pain reprocessing therapy is evaluation and education. So we are evaluating people, doing physical exams, doing a very detailed history to see, is this a structural cause or is this a neuroplastic cause? And as you're doing the evaluation, people are also learning about themselves. They're learning about their body and they're learning about how their nervous system is working. And so it's actually not uncommon for people to have like a book cure. So as Sonya was saying, like even just reading a book, watching a podcast, that can significantly reduce symptoms because people actually understand what's happening in their body. They're learning about why are these signals all happening, right? The second pillar is gathering and reinforcing personalized evidence. So what I recommend people to do is start keeping track of an evidence sheet, right? So every time your symptoms are better or every time your symptoms are worse, you write it down. And so eventually you'll have a whole collection of things to just show your brain like, oh, like my symptoms are changing and it doesn't really make sense why they're changing. And that kind of helps the nervous system to be convinced that there's not a physical thing that's wrong with me, it's just my nervous system, right? Addressing emotional threats. And so I think everyone in this room can agree that our internal state, our emotions, our thoughts, and our feelings are sometimes the most threatening things to ourselves, right? If we're depressed, if we're stressed, or we're anxious, we're gonna be, you know, that person who's in the forest, like looking for like sticks and snakes all over the place, thinking that you're gonna get hurt, right? So obviously your pain is gonna be amplified when you think that you're in danger because of your thoughts and because of your emotions. So addressing those will just help to make the nervous system feel more safe. Somatic tracking, which we'll do in a couple of minutes, but somatic tracking is basically a mindfulness technique that helps people to relax their bodies, but also to train people how to look at sensations from a lens of safety, okay? How to detach yourself from these sensations with a curious observational point of view, and we'll do that in a few minutes here. And promote gravitation towards positive sensations. And so, yes, it is important to feel less bad, but it's also important to feel more good, right? If someone is more happy, if they're more at peace, if they're thinking more positive thoughts, it's more unlikely for them to, you know, be sucked in to their pain, okay? And yeah, so now it's time for a somatic tracking demo. So if you would like to participate, I just invite you to sit in a comfortable position with your feet flat on the floor. And I'm gonna get you to put one hand on your belly, one hand on your chest, and to close your eyes. I want you to just listen to my voice, and any question I ask, just answer it in your head. Obviously, it's going to be a little bit different because we're with a group here. So, what I want you to do right now is I don't want you to change anything. I just want you to see if you notice any physical sensations in your body. So, if you have any pain, or maybe you're noticing the chair, or maybe there's some wind on your face or something, whatever it is, just look at that physical sensation. Now what I want you to do is, as you're looking at this physical sensation, I want you to see if you can describe it in as many adjectives as you can. Is it hard? Is it throbbing? Is it sharp? Is it dull? Is it smooth? Whatever it is that you're looking at. So the more you can describe something, the easier it is for you to detach yourself from what that sensation is. So it's easier to separate yourself from whatever that pain or whatever that sensation is, okay? Now what I want you to do is, I want you to bring your attention to the sensation of the breath. So what does the breath physically feel like in your body? And where are you feeling the breath? Are you feeling your breath in your nose, in your throat, in your chest, in your belly? And what does it feel like? Is it smooth? Is it cold? Is it jagged? Is it shallow? And pay attention to what the physical sensation of the breath is. As you're paying attention to this, try to make this sensation of the breath an anchor for you. So you're going to notice some distracting thoughts, you're going to notice some noises in the room, you're going to notice maybe there's some pain or something in your body. every time you're able to notice something and say hi to it, and then bring your attention back to the breath, that's a rep. You have just rewired your brain ever so slightly. Just like when you go to the gym and you do reps to build your muscles, this is how you build the muscle of your brain to have more control and awareness of what's happening, okay? Now what I want you to do is, I want you to try to take some slow, deep breaths, as deep and as slow as you can, and I want you to see if you can breathe into your pelvis. And I know this sounds kind of funny, but in traditional Chinese medicine, we say we breathe into our pelvis because that's how you can get the breath all the way down. And so you should be feeling the hand on your belly expand more than the hand on your chest, okay? As you're doing this, pay attention to what does this feel like. Now what I want you to do is picture all of the air that's going into your body is like the breath of life. It's the clarity, it's the freshness, it's the energy. And as you're breathing in, all of this air is going to every single cell in your body, and it's giving you all of this energy and clarity and peace and all the nice things in the world. As you exhale through your mouth, I want you to picture all of that negativity, all of that tension, all that anxiety just leaving your body through a slow exhale through the mouth. Now what I want you to do, on your next slow exhale through your mouth, I want you to see if you can release some kind of like a sigh or a noise, like a or like you can even do like a hum, like a This is something that people have been doing for thousands of years all across every single culture, okay? There's something about vibrating the vocal cords that taps into the parasympathetic nervous system, into the vagus nerve, to just bring that relaxation response all throughout the body. It's a very powerful thing. You can do this at home if you're embarrassed to do this in front of everyone here. But focus on exhaling through the mouth slowly and see if you can make a little bit of a vibration. And for your next exhale, I want you to see if you can just release any tension in your body. So if you have tense shoulders, maybe you're clenching your butt cheeks, maybe you have a tense jaw or something like that. As you exhale, I want you to release whatever that tension is with the breath. The breath is getting rid of the tension, okay? However you're feeling now, I want you to take a snapshot in your brain of how you feel. Hopefully, you feel different than before you started this process. And I want you to remember that you have the power to change how you feel just using your mind and just taking a couple minutes. This is something that you now know how to do for the rest of your life. This is just a really quick intro. Obviously, there's a lot more details when I'm working with someone one-on-one, but you can bring your awareness back to the room and we can do a little bit of a Q&A now. Just so you know, again, here's a QR code to an article that has more details about pain reprocessing therapy. Here's a link, and we also do free 10-minute consultations. I'm working primarily for chronic pain, mental health, and men's health at the Kingston Clinic. But we have all kinds of practitioners, so really any health concerns you have, like, we have someone for it. Sonya is always looking for people to fill in the gaps in the team, and she's been doing this for a really long time, and I'm so blessed to be here, and thank you so much for this opportunity, everyone. How's everyone feel? I was doing it with you guys. Question?
I totally buy into this.
Awesome.
I actually teach on chronic pain in my courses at the university.
Hey, cool.
School of Kingston.
Amazing.
That's amazing, yeah. So we use that nail through the shoe example as well.
Yes.
Our students just,
Love it.
Yeah, it makes so much sense, right?
Yeah.
I was wondering how many sessions are on average you
Yeah.
find, I know that study from 8, but it was quite a lot of things
Yes.
too within it.
Yes.
So, you know, at what point when they get to the actual therapeutic
Yep.
stage,
Yep.
like how many sessions do you want to see, or how long does
So
it take?
I don't have a clear answer for you, of course, but so this is research, right? This is in a vacuum. That's not real life. No one can do 2 treatments a week. So I usually say 8 to 12, but you have to be like really dedicated, right? And so the more work you can do, if you can read more books, if you can practice every single day, you'll have less amount of sessions, right? But obviously, finances are always a consideration too. So some people will see me once a month and it'll be a longer process, but I'll just give them more resources and just kind of help to guide them along the way. But obviously the more someone can meet with us, the faster it'll be because they're always building on stuff, right? The biggest difficulty for me is if I don't see someone for a long time, they actually forget to do stuff, right? And so that is kind of a consideration to have. But if someone is seeing me and they've already read the books, right, they've listened to podcasts, they have a really solid understanding of this stuff, I'm just really just answering questions for them, doing somatic tracking with them, giving a little bit of guidance here and there, but they're doing most of the work. It's always, and that's another thing with naturopathic medicine, is we always encourage people, they're in the driver's seat, right? I'm here to guide you. I'm not doing this for you, right? Only you can do this, to rewire your own brain. And that's all the stuff like at home. I'm here to just give you guidance. Does that answer your question?
Yeah, I was thinking with the brain and the plasticity, like how, and this is probably individual, how many repetitions something takes before it's done the work and it's made that new pathway and it's stable.
Yeah. And so it again, it really depends on the person. So I'll go back to even to this slide here. So if someone has childhood trauma, if they have multiple mental health diagnoses, if they're on medications, that also kind of makes it harder because medications, yes, can help someone to do the work, but also in a way it's going to hold them back from fully doing the work because their body is still subconsciously thinking that they're reliant on the medication, right? And so, I can only do so much. They have to work with their team of practitioners, right, to, get into a good way of life, and I'm not in complete control over that process. But yeah, does that answer your question?
Yeah, I guess I just look at like learning to ride a bike or learning to read. Some kids can do it, in 25 repetitions. Other kids need thousands. Right?
Yeah.
So yeah, it's very individual.
And so what I'll say is, most people who practice pain reprocessing therapy are therapists, and they're only doing the mind stuff. As a naturopathic doctor, I'm looking at everything. Okay, and so if someone is able to get their sleep, their diet, their exercise, their stress, like relationships, all that kind of stuff, if they can get all those things in order, it'll be easier to do this brain stuff, right? But it all depends on the person, right? So some people, their whole life, they've been like this. They actually don't even know what it feels like to be happy or at peace, right? Some people, when I try to get them into this parasympathetic mode, it actually causes them panic because it's unfamiliar, it's unsafe to them. Right, so it'll take longer for those people.
And people with attention deficit can really have trouble focusing and
Yes.
really have...
Yes. So one thing I'll say about that is obviously attention deficit is a bucket to put people in, but within that bucket everyone is kind of different still, and so it depends like how medicated are they, what are they doing, how are they managing their life, like what is their life like. And so meditation itself actually has research to help people with attention deficit on its own. So this actually would also help with the attention deficit in a way. So some people it actually may be double beneficial. Some people it may be harder because harder to concentrate, right? Yeah. But with somatic tracking, you're only doing it for like 5-10 minutes at a time, right? Like you can do it for longer if you really want to, but it's about like the repetitions and how consistent you are. So I always tell people like do somatic tracking like 2-3 times a day in different times of the day, like right when you wake up, when you're at work, when you're stressed, when you're at home, when you're out on a walk, in different contexts, so your brain can learn how to do this in different contexts, right? Does that answer your question?
I guess.
Yeah, I'm someone who doesn't give clear answers, so I'll do you first.
Yeah. So just going back to what you said earlier, so I did some work with a pain processing therapist, but was a social work. So
Yes.
How does your work differentiate if you're looking at more like the whole picture? You said like nutrition, sleep.
Yeah.
How
So
would you differentiate with that?
pain reprocessing therapy is one thing that I do. We call this talk that because this is like the research really supports this, but so. I'm doing a full naturopathic intake with people. So there may be supplements involved. There's going to be definitely for sure diet, exercise, sleep, figuring out what this person's life is like. And then every session will end with somatic tracking and then just talking about homework and stuff like that, right? So for me, it's like the chronic pain is just one part of someone's life, right? There's so many other areas that, I'm not in the business of helping people to be pain-free. I'm in the business of helping people to get their life back and to actually, by the time someone finishes this process, their life is better than before they started, because a lot of the time there's lots of meaning and significance with why they became sick, right? The body is asking them to take care of themselves, and a lot of these people have never actually taken care of themselves before.
Yeah.
So that's kind of what I bring to the table, is like helping people to actually live better. It's not just about the pain for me.
Yeah, and also not getting rid of, like, not expecting pain to completely go away, but just how to manage your life within.
That's right. That's right. It's understanding that pain is a danger signal, right? Anytime you feel pain, it's your brain telling you should do something about it. So it's also changing the relationship that people have with their symptoms to know, like, okay, someone who's gone through this process, they'll know, like, okay, at work, I'm feeling a little bit of tinge of pain, so they're telling themselves, like, okay, brain, I promise I'll do some somatic tracking when I get home, right? And so they're learning how to talk to themselves better, because, most of these people have a certain personality traits that are just always putting them on high alert. So perfectionism, people pleasing, right? I'm like most of these things here. And so unlearning all of that and just learning to be kinder to yourself is how you build that connection with the nervous system, right? And so, naturopathic stuff, diet, exercise, it all fits into taking care of yourself, for me and for us.
Yeah, and from a slightly different perspective, this helps. For the clients who come see me, it's more like we've got a certain threshold of sympathetic dominance before we hit that danger signal in our brain, right? We've got a certain threshold before we hit this danger signal, and then all the symptoms come after that. It's like, how full is this cup? And part of our job is to figure out what's contributing to that threshold in the brain before now it's going to top down create this pain. So if we can take an individual, because there are no protocols, and I can say, what if we can buffer those stress hormones with some adaptogens like ashwagandha or rhodiola? What if we can really get you sleeping and sleeping efficiently without those pharmaceuticals that are interrupting those stages in your, sleep stages that you're moving through naturally at nighttime where regeneration happens? And we're just trying to knock off on a very individual level what's contributing to that threshold, and then often the pain does resolve. It's not that it just remains and our relationship with it has changed, but quite often it does go away.
Well, from women who have given childbirth and they realize that excruciating pain, but they do it again.
It's associated with such good things.
That's
Yeah.
right.
They give birth again, and if it was really that, and I'm not saying it wasn't, I'm not trying, but they do it willingly.
That's right.
Do it again.
That's right. Yeah, the meaning behind the pain. I use.
So they suppress it or
Or
manage it somehow.
The
but,
brain processes it differently.
Right.
I use the example of tattoos all the time too. Like a lot of people I know who are covered in tattoos, like they're actually scared of going to the doctor to get a needle. It's like you're getting thousands of needles every time you go for a tattoo because they want to do that, right?
Yeah.
Question here?
Yeah, I was just wondering if you could recommend a book on.
Yes, so use this QR code, go to our website. We have a bunch of resources there. The main book is called The Way Out by Alan Gordon. He's one of the creators of PRT. So PRT was created by therapists, medical doctors, neuroscientists, and they published this paper, they've written books about it and stuff. That's the main thing I would say, but there are tons of resources. If you just Google pain reprocessing therapy, there's a lot of people are talking about it now. Yeah.